Imagine being robbed and having important things in your life taken from you before you even have time to react. Your money, your wallet, your electronics, and even your car. I think we can all agree that this would be devastating. Now imagine being robbed gradually over several years and not being able to do anything about it. Being robbed of your memories, your personality, your ability to solve problems, and even your ability to take care of yourself and be independent. This is what Alzheimer's disease does to you. I have learned firsthand what this disease does because my grandpa was diagnosed 5 years ago with Alzheimer's disease. Today, Alzheimer's disease is frequently heard in the news or on TV, so I'd like to share with you what Alzheimer's disease is, who it affects, and what to expect if someone you know is diagnosed with this disease. Alzheimer's disease has not always been as well known as it is today, which may be surprising since it was identified over 100 years ago. In 1906, Dr. Alois Alzheimer, a German physician, presented a case history before a medical meeting of a 51-year-old woman who suffered a brain disorder. A brain autopsy showed the plaques and tangles that today characterizes Alzheimer's disease. Webster's dictionary defines Alzheimer's as a progressive, irreversible disease characterized by degeneration of the brain cells and commonly leading to severe dementia. According to the Alzheimer's Foundation of America, diagnosis can be made at any age. It is a very devastating disease that affects millions of people by destroying the brain and is the only cause of death in the United States that cannot be prevented or cured. Alzheimer's disease can also be hereditary. Alzheimer's disease can affect any adult at any time, whether you are a carrier or not, although there are some risk factors that increase a person's chances of getting Alzheimer's. Of the 5.3 million Americans with Alzheimer's, an estimated 5.1 million people are aged 65 and older, and approximately 200,000 individuals are under the age of 65. And almost two-thirds of the Americans with Alzheimer's are women. In every 67 seconds, a new diagnosis of Alzheimer's disease is diagnosed in America. And by 2025, the number of people aged 65 and older with Alzheimer's disease is estimated to reach 7.1 million. If a cure is not found, there are specific stages that a person with Alzheimer's will progress through prior to dying. Stage 1. No impairment. You have a normal function, just like me and you. They do not experience any memory problems, and there are no symptoms of memory loss or cognitive impairment. Stage 2. Very mild cognitive decline. The examples of this are forgetting where you put something or forgetting someone's name. At this stage, people are still able to live independently, work, and drive, and symptoms are probably not noticeable by anyone else. In stage 3, it's mild and cognitive decline. This could include having difficulties at work, trouble with planning, and difficulty organizing information. Other people may notice that you are having some difficulties with your memory or completing a job. May discover challenges in planning or solving problems. This could be forgetting to brush your teeth, forgetting to comb your hair, or not changing your clothes. You could also be confused with the time and place, and this may be when a diagnosis for dementia or Alzheimer's is made. In stage 4, it's moderate cognitive decline. Symptoms of this stage include forgetting recent events, difficulty completing complex tasks, and becoming moody or withdrawn from people. You may discover new problems with words and speaking or writing. Your judgment can also be impaired so that you would now realize when someone is unsafe or should be avoided, and changes in mood or personality may happen, and medications may help to slow the progression of the memory loss. In stage 5, moderately severe cognitive decline, you can become confused with time and day and be able to recall their address or phone number, but you're still able to take care of the personal needs. Gaps in memory and thinking are noticeable, and patients need more help. They may choose winter clothes on a hot summer day or go outside without shoes on, or it may be difficult to keep the person at home, and they may become suspicious or delusional and may need 24-hour supervision because they don't have the judgment and reasoning skills to keep themselves safe. In stage 6, there's severe cognitive decline, characterized by being unable to recall names and faces and needing help with daily tasks, and the person may wander and become lost. They may put clothes on over top of their pajamas while getting dressed, or even forget how to use the bathroom. They may not know current events, the name of schools they attended, or may confuse their wife for their mother. And speaking also becomes very difficult, and their speech may be characterized by jargon and nonsense words. And lastly, in stage 7, is very severe cognitive decline. This includes losing the ability to respond to their environment, needing help with eating and daily needs, and reflexes becoming abnormal. And during this stage, patients may not be able to communicate, control movements, and may lose the ability to smile or sit up with support. And the person with Alzheimer's will require constant care with all of their basic needs. These stages can develop over 2 to 20 years with an average lifespan of 8 to 10 years after the diagnosis. Alzheimer's disease is the 6th leading cause of death in the United States and the only cause of death in the United States that cannot be prevented or cured. It robs you of everything that you are and robs those around you of the family member you used to be. Alzheimer's can affect any member of your family, so it is important to know what Alzheimer's disease is, who it may affect, and what a person might go through if they are diagnosed with this disease. Don't let this disease steal a family member from you.